Hello and welcome to this week's episode of For the Love of Chiropractic. I'm your host, Dr. Robert Freeman. And on this week's show, we're going to be talking about something that we have never talked about before. We're going to be talking about what you do, how you handle the super acute patient who comes into the office in horrible, horrible pain. Welcome to Season 3 of For the Love of Chiropractic. Season 1 has 60 episodes of practice management tips to help you build the best practice possible. Season 2, 3 keys of my success, 50 interviews with the most successful chiropractors from around the world. Season 3, resources for your success. So let's listen up and learn how to build a great business. So as I said in the introduction, on today's show, we're going to be discussing that super acute patient who comes into the office in horrible, horrible pain. On previous episodes, we have gone through and talked about the more routine patient who comes in. Maybe it's chronic pain. Perhaps they were in an auto accident. Perhaps they woke up this morning, with a headache and their neck's not feeling right or something like that. And we've gone through talking about how to take a proper history. We've talked about in detail the other day one procedures. We've talked about the release procedure for day one after the complete examination and other diagnostic testing that you may do. We've then also talked about the home instructions that you give them. And we talked about day 2 on multiple episodes. Greeting them back in the office, the report of findings, and how you explain to the patient exactly what's going on with their body, what has happened, and then what you can do, what chiropractic can do, you and your office, in order to help them get better, feel better, correct the problem, strengthen the correction, and then help them maintain proper health. Or as I like to say, relief, correction, strengthening, and maintenance. The 4 phases of great chiropractic care for a longer, healthier life. But on today's show, we're not going to be talking about those things in detail the way we have previously. No, on today's show, we're going to be talking about the systems, procedures, and practices that you and your entire office staff need to provide to the person who shows up in horrible, horrible pain. When I say horrible, horrible pain, what I'm talking about is the person who calls on the phone, or often it's their spouse who calls on the phone and says, I have a patient, my spouse, my kid, my mother, my grandparent, who's in horrible pain. Can you see them today? And do you make arrangements for them to be seen today? I don't think you should ever keep your regular patients waiting to take a maybe by phone. But as a doctor, we do have this deep-seated obligation that we feel to help somebody who's in horrible pain. So find a way to make it work. Maybe you don't say, get over here as quick as you can. Maybe your front desk chiropractic assistant gets you on the phone and you take a mini history to find out exactly what's going on. So she says something like, I'm going to ask you to hold. The doctor is finishing with a patient right now. Let me get him or her on the phone with you, and we're going to help you today. We're going to do our best to help you today. Okay. The person's holding and they're waiting. They're as comfortable as they can be, sitting where they are, presumably at home, or laying down at home. When you get on the phone, you start to ask questions. Who is this person? What is the problem? Okay, so what is your name? May I ask how old you are? When did this start? How did it start? Tell me about the pain on a scale of 0 to 10, and they usually pick a number that's greater than 10, 12, 15, 100. When you say, pick a number between 0 and 10. What have you done for it? Can you get comfortable in any position? Have you taken anything? How long have you been awake? Have you been mobile at all? Can you get up and get to the bathroom? These are things you're going to want to know. How mobile are they? If they just woke up a few minutes ago and are in horrible pain, most often that pain will begin to subside somewhat with some gentle stretching as they ease their way out of bed, or maybe it's even off the floor, as they attempt to go to the bathroom. But what do you tell them to do at that moment? Based on your skills and the history that you've taken, you can tell them to apply heat, to apply ice. Depending on the severity and your chiropractic philosophy and the laws in your state or country, you may even recommend some sort of over-the-counter medication like ibuprofen or acetaminophen or good old school aspirin. Maybe, depending on what's going on. Use all of your clinical knowledge. We know that ibuprofen isn't going to fix the problem or any of the other medications, but perhaps they need that to take the edge off, or maybe they don't. It's very case specific, and you're the doctor. You get to decide that. Once you've made those decisions, you might tell the person, try this stretch. Do 3 repetitions of this stretch or that stretch, and do that every 30 minutes for the next 2 hours and call me back. Or do that for the next 2 hours and I'll call you back, because I want you to start easing this so I can get you into the office, so you can get into the office, so we can really see this and start to help you fix it. Often there's something that you can give them to do at home. It's not going to fix it, but the patient is going to be incredibly appreciative that you've given them something to begin with, as opposed to just get in here as fast as you can. Well, and the get in here as fast as you can, again, you haven't told them a whole lot. Should they be driving? Probably not. Should they be sitting in the front passenger seat? Maybe, maybe not. Depends on what's going on. Should they lay down in the back seat of the car? Maybe. I had a patient one time in such horrible acute pain. Joe was his name. His brother brought him up to the office. He was in the back of the pickup truck. Now, Joe was a big man. I mean, he was well north of 400 pounds. But he said laying in the back of that pickup truck was the most comfortable he had been since he woke up that morning in acute pain. So, giving patients advice of how they can best get into your office also is incredibly important. And by the way, telling them that they shouldn't be driving is established case law regarding malpractice. You have an obligation to tell them they shouldn't be driving if they can't properly control the car. So now that we've handled that piece of it, let's talk about what's going to happen when they come into the office. There's some initial paperwork that has to get filled out. And for the typical new patient, they comfortably sit in your reception area and they start to fill out that paperwork and they watch the flow of the office and they get the feel for how things go. This person is not going to be sitting comfortably in your reception area. In today's world, many offices have the capability to send the paperwork to the person's house so it can be filled out before the person even gets to the office. With an acute patient, I highly recommend that if you can do that. If you can't do that, when they come into the office, you've told the front desk, when this person gets here, here's where I want them to go. Perhaps you want them to be moved immediately to the examination room. If you have a separate room that you do your consultation compared to the examination, I don't recommend doing that consult on this particular patient in your consultation room. Because the less they have to move around, the easier it's going to be for them in your office. So when they get here, take them straight back to the exam room. Perfect. And then you go back and do the consultation with them. Get to know this person. Who is it you're dealing with? What is it that they exactly need the help with? And then as quickly as possible and as gently as possible, once you have completed the history, do a proper examination. Maybe you're not going to do every orthopedic test in the world. If you typically do a full spine exam, and I think every chiropractor should be, perhaps if it's an acute lower back, you're going to minimize the cervical portion of the exam to really focus in on the lower back, or vice versa. If it's primarily a cervical issue, or an atlas issue, perhaps you're not going to spend as much time checking Kemp's maneuver to see what the facet joints in the lower back are doing. That doesn't mean ignore them completely, because the spine is one neurobiomechanical unit, and every part does interact with all the other parts, so you have to have some idea what's going on. You can't ignore it completely, but focus in on what needs to be done. If any type of advanced testing needs to be done, x-rays or any type of nerve testing you may do in the office, make sure you do that, having the person as comfortable as possible. And once you have completed this examination process, with the typical patient, you go through a release process to give them instructions of things to do at home. They can go ahead and get dressed if you're gowning your patient, as some states still require. And then you send them home. They go to the front desk, they set up their report of findings for tomorrow or the next day. But it's different with the acute patient. What I recommend is you get them set up with some sort of pain relieving modality if you do modalities in your office. Perhaps it's some sort of electric stim. Perhaps it's some sort of ultrasound. Perhaps it's a laser technique. There are many, many things that can be done. But explain to them, I'm going to take a few minutes to review all of your exam findings and the x-rays or other advanced testing that we did, so that I have a better idea of exactly what's going on with you, so we know precisely what we should do to help get you out of pain as quickly as possible. While I'm doing that, we'll be doing this other procedure to begin to minimize the pain. Does that make sense? Maybe it's ice, maybe it's heat, maybe it's ultrasound. Again, any one of the things it could be, and explain why that's going to help. The hot pack we're going to put on there is going to help to reduce the muscle spasm and the knotting in those muscles. The ice that we're going to put on there is going to help to reduce the inflammation so I can start to move those bones easier to start getting you out of pain. And again, if possible, I'm going to recommend do those procedures right in your exam room, or perhaps move them to one of your treatment rooms if that's an option in your office, so that again, they have to move, that's fine, but we're moving them around as little as possible. By the way, once you've gotten that procedure started with them, whether it's you or one of your chiropractic assistants, that frees you up to go see the patients who have been waiting while you've been taking care of the acute patients, because an acute patient does require more time than a typical chiropractic adjustment regular visit. And as you've done that, you then also have time to review the tests and the films, so you really do know exactly what you're going to be doing. Once you've caught up with all of that, if the person has been on that other procedure for 15 or 20 minutes, as is typical, you can then go back to them. And here's the thing that most doctors miss. When you get back in that room with the acute patient, and you can ask, how are you feeling? Did that start to minimize it some? Are you comfortable? And be careful, because those are all loaded questions. You can say to them, I need to take a couple minutes and explain what's going on. Because if not, legally, you should not be treating the person without doing a report of findings. You haven't told them what's going on. You haven't told them what you're going to do about it. Now, before you did the other procedure, again, you said, I want to use this modality to help for this reason while I review other tests. That counts as a mini report of findings for that piece of it. So then to take your time and your expertise and explain, maybe not in all the detail that you do on a regular patient, but explain in some way, shape, or form the basic chiropractic philosophy above, down, and inside out. And the bone has shifted, it's pinching the nerve, there's a muscle spasm, that pinched nerve is causing pain. We're going to work to get the bone off the nerve. We're going to work to reduce the swelling and inflammation, to start getting motion in there. Do you have any questions? That short, simple report of findings for the very acute patient, and you get a verbal agreement, okay, let's start getting you better. They've given you informed consent, and you have explained what it is you're going to be doing. One of the worst things that you can ever do, the person is laying face down and they've had a hot pack on them, is just to step up and go ahead and perform a chiropractic adjustment. Legally, you've just assaulted them. You didn't tell them what you were going to do. They didn't agree to it. Now, you and I know that that's going to help, but you didn't have permission to do it. So what are you doing? And for the adjustment on this super acute patient, I recommend you go as gentle as possible and still work to get the job done. As gentle as possible, and move the bone if it can be moved. Do what needs to be done, but don't put them in more pain. You're not going to make it move and rack them and crack them, because they're going to get worse. They're going to have a bad opinion of your office and of chiropractic in general. Go easy, go gentle. And when are you going to adjust them again? Once you've gone through and done the procedures you need to do, maybe you did some modalities before while you were reviewing the tests and x-rays, and then you review things with them briefly, and you explained, I'll go into more detail as you get out of pain, as you're getting better over the next several days. Fine. Maybe you'll do another modality after that adjustment today also. And then when are you going to see them back? If somebody's incredibly acute, you know what? Maybe you let them rest there right in your office for a half hour and tell them, and then we're going to treat you again. Or maybe you tell them to go home and come back in a couple hours. Maybe have them go walk around if you've eased it up enough, and come back and adjust them again. In my almost 40 years, the most that I ever adjusted somebody, I think, was 4 times in one day. You know why? Because they needed it. Now, in my practice, I never charged anybody for more than that one office visit in a day. If they needed to come back multiple times to be adjusted a second, third, or even that 4th time, there was only one adjusting fee per day. Again, you can do as you see fit. That's what I thought was right. And then maybe the next day, and I strongly recommend you do see them the very next day. Don't tell them to go home and wait 2 or 3 days. Again, maybe you'll adjust them more than once that day, depending on how acute they really are. But as it starts to settle down and they are improving, then sit them down and do a proper report of findings at the point that they can tolerate it. They can really sit for the 15 or 20 minutes and be reasonably comfortable or extremely comfortable and really understand what happened, what you're doing about it, and the process that they're now in, and what the real timeline looks like to go through relief, correction, strengthening, and maintenance. Because it's wonderful when we can say to somebody, this episode that you just had, I'm going to do my absolute best to make sure that this is the last episode like this you ever have. And everybody appreciates that. And what I can tell you is if you do this successfully, as I have done many times over my career, and many other highly successful chiropractors have done as well, you've created a lifetime patient who really appreciates your skills when it's acute, and when it's more routine. One last thought regarding treating everybody on the first day, because I've known lots of chiropractors who like to just jump in and start treating people the very first day they walk into the office. I have known very, very, very few highly successful chiropractors who treat patients on the very first day. It just is not what's typical in successful chiropractic practice, in typical physical therapy practice, and in many other areas of healthcare. No, day one, except in the extreme cases, day one is let's gather the information. Day two is let's review the information and what it means and what we're going to do about it. And then on that day two, let's go to work figuring it out and actually doing those things. What's interesting is, very often in the physical therapy world, they don't even begin treatment on that day two. No, after the physical therapy report of findings, they very often say, okay, head up to the front desk and you can set up your schedule for when you're going to come in for those treatments. And they have time later in the week or sometimes not even until the next week. That's not typical in chiropractic. But again, the point is, treat people the way that they really need to be treated. And for the person's best health and best long-term outcomes, don't do a treatment, an adjustment on day one in the office unless they're super, super acute, as we've just spent our time talking about today. All right, and that's our show for today. If you have a question about today's show or your own practice, feel free to reach out at fortheloveofchiropractic.com. Before making changes to your practice, be sure to seek legal advice regarding those changes and regulations in your state. For the Love of Chiropractic is an RGF production, all rights reserved. And thanks for listening. Original music provided by Hunter Rich Music.